Go.
So the other finding with Chris at the pelvis was possibly a dysfunction in the posterior chain. And we can test for this by asking Chris to raise his foot in prone position, again about a foot off the couch. Now, if glute max is working properly, it will contract first, followed by erector spinae and hamstrings. So what we can do is place finger, thumb and fingers contact over those three components. And Chris, if you can just raise your foot off the couch, quite clearly feel a contraction first in hamstrings, followed then by erector spinae and finally glute max. So although these muscles are firing, they're firing in the wrong order. Compared to the left hand side, so Chris, if you can just raise your foot off the couch. So I get a firing first in glute max on this side, followed by hamstrings, and then erector spinae. So this glute max chain is firing better, in a better order. In terms of what I can do in treatment, I can work on these muscles and areas of fascial tissue which have been overworking, and I can give Chris some simple exercises to help get his muscles to fire in the right way. A good example of this would be to get Chris to go away and do prone leg raises himself, but making sure he's firing his muscles in the right order. So Chris, if you can first of all just gently squeeze your buttock on this side and then raise the leg. Okay, so now we have a better firing pattern. We have glute max firing first, initiated by Chris himself, followed by hamstrings and erector spinae.